burning truth. So when I ask questions, answer alternatively. Okay?
Okay, Miss Magic, we had that. We made the PowerPoint. We filled it in. If you want us to pull that up.
You can just answer the question. I have the PowerPoint. You can see my PowerPoint, right?
Yeah.
Okay. So so the other two groups who did not have the hold on. Let me just. All right. So the other two groups who did not have this case study, please tell them what is the case study about. Anybody from either group?
It's about a family whose house catches on fire, and the case study asks about the different people in the house. It asks us about them. Some of them have different types of burns.
Mm-hmm.
So.
Thank you. So this is the family home, and they had a dog, and there was a fire on Tuesday night.
Yeah, there's sound effects in those.
There is sound effects, which is let me see if I cannot play that one because I did not download that. Yeah, it's the fire catching the whole house, right?
Yeah, and one of the family members screaming. That's where they are.
See? Okay, thank you. So you are setting up a room in the emergency room for Stephanie. Stephanie, who is Stephanie?
She's the 45-year-old that was in her room, took a sleeping pill, and fell asleep.
Yeah. So, which of the following equipment is necessary at the bedside?
We said everything except C.
Except C. What about the other group?
I have everything too, except C.
Except C. Why did you exclude C?
I just thought that initially the patient wouldn't be really able to tolerate oral fluids, so we would just stick to the IV rehydration. So, and to protect the airway too.
Okay, very good. So, the fluid, you are okay with this fluid?
Yeah, lactating bringers.
Lactating bringers?
Yes.
Yeah.
How much will you give the fluid?
5,520 in the first 24 hours.
According
What is this
to
medication?
Parkland.
What med are you giving to this IV? Are you just giving the fluid or something else?
Oh, morphine.
Morphine and
is the drug of choice.
propofol.
Okay.
And propofol.
Okay. And then you will start a Foley catheter. Why?
Monitor fluid output
because of the fluid therapy.
Okay, which is very, very important in burns. Okay. Yes. Oxygen, yes, it is. It is the most important. Why?
Because if she inhaled smoke,
Yes.
her airway may close.
Yes. So so the burn interventions are always linked to what kind of burn the patient has. Okay. So yes, oxygen is very important. Good job. Now the emergency room and paramedic staff transfer Stephanie onto the ER stretcher, ensuring the IV remains intact. Assign the priorities of care to yourself and your peers. You RN.
So for me, RN, I put assess airway and start second IV. For the other RN, I put assess burns and apply moist dressing. And then for the PCT, we put apply cardiac monitor and apply oxygen.
Okay. Start second IV. Who is starting the IV?
Myself for the URN.
The second RN should start the IV because start second IV. We already
Okay.
have one IV, okay, which is running and which you can connect the fluids to, right?
So the reason I did it the way we did it with the second RN doing assess burns and apply moist dressing is because that nurse has already got the burn. So if she's gonna be applying moist dressing, why would the nurse switch locations, and why would the first nurse, assess the burn and then a second nurse apply the dressing? If she's already there at the burn, go ahead and let her do that. And then I just split up in task of 2 each. So one nurse is not only doing one thing.
Efficiency.
Okay. So if I were you, I would assist as that is my patient, right? It's going to be my patient. So I will be assessing the airway. I will be assessing the burns. My second RN, who is coming there to help me, I will say that, start a second IV on the patient. Because I am the one who is going to document everything, right? So I am the primary nurse. I will be doing all the assessment. The other RN will be helping me with starting a second IV or applying for moist dressing. And the PCT, what you said is correct. Okay, they can apply the cardiac monitor and they can apply the oxygen nasal cannula, but they cannot start the oxygen. Okay, it will be the RN who will be starting the nasal cannula or saying that, okay, 2 liters of nasal cannula. Okay, or how much it is. All right. The next was rule of nines, right?
Yeah, Ms. Matthews, quick question on that.
Yes.
Because when you go down the next slide, you're going to see it talks about the Lund-Browder chart. For our testimony, when we have to calculate with the Parkland formula, is it going to be using the rule of nines or using the Lund-Browder chart?
Rule of 9.
Okay, thank you.
Yes. The other one, I know it's a little confusing, right?
Yes.
The Lund-Browder's formula.
You'd have to have the chart to refer to if we were going to use it.
Yeah. So the rule of 9, based on the rule of 9s, you confirm Stephanie's burns. What total body surface area is affected?
Well, if it's based off the question in the notes, it's 27%. But if it's based off the paramedic report, what do you think?
Yeah. No, 23 was the other chart.
Yeah, 23.
We went off what was in the notes at the bottom of that slide, which is 27%.
Okay. Then other group, how much did you get?
I got 25 off of the paramedic, but
Okay, 27%.
Can you guys go over how did you get it? Because I got something a little less.
You can put that this thing on. What is that? The PowerPoint on.
Yeah.
I think John's PowerPoint has the 27% how they got it, right?
Yeah, well, if you look on the notes, it says, so we just looked at, so you looked at the entire right leg, and then it gives the percentages, and then the posterior trunk, and then we just added that, and that's how they got 27.
But it said the abdominal, it said the right side. It didn't say the whole abdominal.
You have the abdomen. You have one arm, and you have the legs, right? If I remember.
Yeah, but that's like I said earlier. That's based. So there's two different things, Ms. Matthews. Slide 11, the paramedic report. It's not the same as if you look on this chart, the slide that we're on, slide 12. Mm-hmm. It only says the right leg and posterior trunk. So it's two different things.
Oh, it's different from the paramedic report?
Yes,
Yes.
it's different.
Okay,
So we went with just what was in the notes on
Okay.
slide 12.
Okay, they didn't.
yeah, go with the notes then. And that's how you got the 27%, right?
Yes,
Okay,
basically.
I'll fix that paramedics report for the,
Those damn paramedics.
was that Gary who said that?
Yeah.
Of course it was.
All right, the next one is this.
We got 23%.
23%, yeah.
Lund Browder's, you got 23?
Yeah.
Yeah.
Abdomen was how much?
13.
Right, lower arm,
See, this is,
4.5.
we were still going off of the notes from slide 12,
okay.
which says entire right leg, foot, and posterior trunk. That's all it says.
Okay, so that's how you got right leg, it was 7, and abdomen 13.
We had to look. We looked at the chart online, and we went off the chart offline. I'm not sure what's in the book off the top of my head.
Trying to pull up the chart, but
That's a confusing chart.
Okay, let's move on. Okay,
So we don't need to know anything about that for tomorrow, Ms. Matthews? The Lund
for
Browder?
the Lund Browder, no, you don't need to know that. Okay,
Hopefully,
you need to
thanks.
know your rule of 9. You need to know how to do the Parkland's formula. Okay.
Okay.
All right. I'll have to revisit my case study. Clinical manifestations for the emergent phase.
We have it on our.
This patient might go into shock, right?
yes.
Yeah. What else? What are the other clinical manifestations?
Dyspnea, difficulty breathing,
Low blood pressure.
Okay. Altered mental status?
Yeah.
Blisters?
Mm-hmm.
Shivering?
Yeah.
Okay. What are the cardiovascular system?
hypovolemic shock,
Okay. Hypovolemic shock.
cardiac rhythm alterations,
Dysrhythmias.
peripheral vascular compromise, low blood pressure, myocardial dysfunction,
Edema. Ischemia.
Yep.
Necrosis. Paresthesias. Gangrene.
Right, yeah. you're good.
And the patient had impaired microcirculation and increased viscosity, which can lead to sludging. Respiratory system.
inhalation injury, carbon
Very
monoxide
good.
is a common,
Yes, very good.
alveolar collapse,
Nausea, dizziness,
Very
coma.
good.
Inflammation.
All this can cause what? If untreated,
Well,
Yeah.
I'm sorry. What's the question?
cause pneumonia.
Ammonia.
And the inflammation can lead to pulmonary edema. And the main thing here you have to keep in mind is that with the smoke inhalation injury, the patient may not even exhibit signs during the first 24 hours. What about the urinary system?
reduced renal blood flow,
Yes,
Dark brown, concentrated urine.
very good. So if the
Muscle damage or release of large amounts of dead or damaged erythrocytes.
okay, if the patient has like dark concentrated urine.
Hello, how are you?
Can you give the patient Lasix?
How can I help you?
No.
I need a reading. Okay.
Hold on.
Can you?
No.
The lady was like,
Why?
it was $100.
Because they're already dehydrated.
Let me see what we have available.
Okay, somebody is talking. Okay, because they are dehydrated, right?
Yes.
And if so, how will you increase the urine output?
Start an IV or
LR.
Okay, moving on. Emergent phase burn management. The airway management. For this patient, what is the airway management?
Maintain the head of the bed.
Okay,
Greater than 30 degrees. Suction frequently. Encourage patient to use incentive spirometer hourly.
how, I don't think the patient will be able to use any incentive. This patient is having a lot of burn, right? She needs intensive treatment. What treatment?
100%.
Are you
100%
talking about intubation?
purified oxygen.
Intubation if necessary.
Very good. Intubation and ventilation. Okay, bronchoscopy, intubation and ventilation if necessary. Wound care.
Wound monitoring
Okay,
if necessary.
okay. What are the other wound care that you will do?
Debridement. Hydrotherapy.
Okay, she has a lot of wounds, right?
Yes.
Yeah. So debridement, if the doctor says wound debridement, she has every kind of wounds, right? There are peripheral wounds, there are open wounds, then there are like deep wounds. So for if there are open wounds, peripheral open wounds, what will you do?
Wrap.
Before wrapping, what will you do?
Wound excision and closure.
So you will wrap those wounds, which are peripheral open wounds. Will you wrap or will you not wrap?
Yeah. So yes.
Yes, you will wrap. They are peripheral and they are open wounds. They are not deep.
Oh, no, you don't.
Okay, now you don't. No, you won't. You won't wrap those wounds which are just peripheral and open wounds. What will you do? You will apply some topical antibiotic. Okay, so with no dressing over the wound, because that helps the wounds to heal fast. So when you're, what are the nurse's responsibility when you're applying?
You're meaning superficial, right? That's what you're
Yes.
saying?
Yes.
Oh, I was thinking you're saying peripheral. I'm like, okay, I get it, superficial. Forget it.
So what are the nurse's responsibilities when you are applying antibiotic cream or topical antibiotic? Anything to keep in mind?
Asepsis.
Yes. So
Hero technique.
you are not using the clean gloves, right? You are using
No.
the sterile gloves.
Want to make sure you do pain management before you start that?
Very, very good. If you are doing the debridement, the pain management is very important. And when will you do the pain management? And what kind of pain management will you give for the patient?
IV
Give them
morphine.
pain, yeah, or fentanyl before you start. That way they're in less pain while you're the breeding or changing wound care.
Yes, so opioid, like Dilaudid morphine can be given 30 minutes prior to, if it is IV, 30 minutes prior to the debridement or dressing change. So does the patient need any graft?
No idea.
For this, your Stephanie?
Mm,
Will she need any allograft or homograft?
It didn't say. No.
No,
Not in the emergent phase.
Okay, imagine if she needs, like in the later stages, if she needs a allograft or homograft. What are your nurse's responsibility? Anything?
graft?
Graft. The skin grafts. Your nurse's responsibility will be elevating that affected area, affected extremity. Okay, that will promote perfusion and decrease the chances of edema. Okay, now nutrition. What are the nutrition? How are you meeting Stephanie's nutritional needs?
Eternal feeding tube or perinatal feeding tube?
Enteral feeding, right?
Mhm.
Yeah, in the emergent phase, you will start the enteral feeding through using a NG tube.
4,000 to 6,000 kcal a day.
Okay, but the patient is not able to have anything via mouth, right? So you will do a enteral NG tube feeding, and it is always important to start it in the emergent phase. Why?
Because nutrition helps with healing, it needs to be done immediately.
because of the loss of energy too.
Yes. Very good. Metabolic expenditure increases by 50 to 100%. Okay, and for the wound healing, it is very important to start in the early emergent phase. The nutrition should be started, and as you said, 5,000 kilocalorie per day. And along with that, you will give supplemental vitamins and iron. What kind of nutrition? What will you keep in mind when you are doing the nutrition, when you are meeting the nutritional needs?
Higher?
High
Protein,
protein and
calorie.
high calorie, very important. Okay, keep that in mind. High protein and high calorie food intake. All right. The next slide was the medications that you already know: analgesics and sedatives.
Morphine, oxy, fentanyl.
Yes. Lorazepam, midazolam. Immunizations,
Tetanus.
very good. Antimicrobials,
Silver nitrate.
yes. Silver, sulfadiazine. Okay. Was there a question here?
It's in the next slide.
Okay. All right, so calculate how much fluid Stephanie should receive. Either group can say.
It was like 5,520. I'm trying to find it.
5,520. That
Yep,
was,
in the first 24 hours.
what did the other group get?
I got 6,480.
I think that's based on how the percentage on that they got. Or
How much did she weigh?
60 kilos.
60 kilos times 4 milliliters, and we had 23%.
Okay, so 60 times 4 mLs times 50 TBSA burn, right?
Yep,
Okay. How much did you get there?
23%.
Okay, so what was the answer for that?
5,520 milliliters in
Okay.
the first 24 hours.
Okay. 132 pounds. Was she 132 pounds?
Yes.
Okay. Because I got 7,800. I'll have to recalculate this. How much should be in the first 8 hours?
First 8 hours is 2,760 milliliters or 345 milliliters per hour.
Did the other group also get the same answer?
Well, they couldn't have got the same answer because they had more.
They
fluid.
had, yeah.
They had more fluid the first 24 hours, so theirs would automatically be different than ours.
Yeah, I will have to recalculate mine because I got 3,900 in the first 8 hours. My total was 7,800 for the first 24 hours. And the first 8 hours, it was 3,900. If it were delivered equally over 8 hours, the IV rate should be 487.5 mLs per hour.
What
Okay.
Lund Browder percentage are you using, Ms. Matthews?
What's that?
What Lund Browder percentage were you using?
See, that might be the reason because there were two different values, right?
Mm-hmm.
Maybe. Yeah. Okay. I'll recalculate and see how much it was. Okay. What is here? What is this one? Morphine.
We got 72
2
mL.
milliliter. Yeah, it's 72 milliliters an hour for the propofol.
Yeah, propofol is 72 mLs per hour.
Morphine was 2 milliliters an hour.
There you go, 2 milliliters per hour. And the normal saline, was it normal saline or Ringer's lactated?
No, it was just
Yeah. Okay, so that is how much? Did you calculate that one?
but there was only 2.
Your fluid that you just calculated, what number did you get for your mLs per hour for your replacement fluid?
350, right? I think that one group got 350 mLs per hour. That will be, for me, it is 487.5, but whatever the fluid was calculated. What type of room should Stephanie be assigned to when the patient is being transferred to the burn ICU?
Private room that's temp controlled.
Yeah, isolation room for protective isolation. Okay, place the steps for the burn dressing change in order of operation. The
Good.
first will be,
D,
very good.
E,
Administer. E, clean wound, yes.
C,
Apply silver, very good.
A, B.
Apply sterile gauze and document wound, very, very good. Okay, Billy. What are the immediate priorities for Billy?
We put B and C.
B is raise head of stretcher and C is placed on cardiac monitor. How about the other group? Raise head of stretcher, yes. Why are you not administering any IV fluids?
Because the patient wasn't burned.
He just inhaled some.
He did. It didn't even say he inhaled like a bunch of smoke. He was having trouble breathing. He was downstairs, but he has a history of breathing problems.
Okay. Why are you placing the patient on cardiac monitor? Which patients are placed on cardiac monitor? Which type of burn injury warrants you to place the patient on cardiac monitor immediately?
Like electrical burns.
Very good. Electrical burns. Okay. So after an electrical burns, there is more chance of dysrhythmias. Okay. So those patients should be the ones who should be on cardiac monitor immediately. But you are raising the head of the stretcher? Yes. You don't need the patient to be intubated, right? No. Okay. ABG analysis.
Gary got this.
Okay. What did Gary get?
Respiratory acidosis.
But partially compensated respiratory acidosis with hypoxemia. Okay, Ryan. Is it appropriate to send Ryan home? Why or why not?
I said yes, only because he was able to breathe on his own, and it was only a partial thickness burn being on his arm. So I figured that's why he let him go home.
And that is correct. It is safe to discharge him as he is able to follow directions and his burns are partial thickness over a small area. Okay, the family has no home to go to. What services can be activated to help the family?
Red Cross.
Yes, very good. Social services?
Community resources.
Community resources.
Oh, you said you had the phone.
If you need pastoral care.
Give me just one second.
And that was it, right?
Yes.
No. Emotional needs of the family.
So can I have the primary?
Angelica, you are not muted.
In the 4-digit PIN.
I hope she muted herself.
No, not yet.
Yeah,
Like-
don't say the 4-digit PIN. Can I mute her? Maybe.
She muted herself.
Okay, good. Emotional needs of the patient and family.
The patient might go through, wait, which patient are we talking about right now?
all the patient, the
Anxiety, depression.
Uh-huh. Stephanie was the one who was
That had the severe burns.
severe burns. Yes.
So she may go for like the way she sees herself, so depression, anxiety.
So early psychiatric intervention is needed.
Mhm.
Okay, assess for psycho-emotional cues. If the patient is, if the patient says that, oh, okay, I can just apply some makeup so that this area is, this area is more covered with, or something like that, or I can just put sunglass to cover my burned area or something like that. That means that the patient is more ready to accept her injuries and they are in their recovery phase. Okay. Family and patient support groups. Issues of sexuality must be met with honesty. And yeah, emotional support, very important. Okay, very good, both groups. You guys did a good job. And